Hi, Shailey. How you doing?
Hi, good.
And for this interview, could you go ahead and state your full name for me, please?
Yes, it's Shailey Tripp.
Okay, thank you very much. And by the way, thank you very much for your time. I really appreciate taking the time to answer some questions for me. According to the National Enquirer, you had a relationship with Todd Palin. Is this an accurate statement?
Yes, that's correct.
And was this relationship sexual in nature?
Yes, it was.
Okay. And about how long did this last?
It started probably in early 2007 until about the end, December of 2009.
Okay. And during that time, during that time or after that time even, did you ever have a chance to meet Sarah Palin, the governor?
I did. I had formerly met her at a place that I had worked at.
And can you describe how that encounter took place?
One day when I went to that particular work to pick up the paycheck, the massage therapist that would have worked that day didn't show up, and basically they just asked if I wanted to make some extra money that day and if I would have time to give a massage. And I said yes, and I had no clue who it was or anything like that until I had walked into the room, and that's how I met Sarah Palin. Was I had gave her a massage just one time.
Now, this place is the All About You Spa, right? And I went there to see what the criteria were, and there were some health screening paperwork that they had available for their clients. Do you know whether or not Sarah Palin had to fill out that same kind of paperwork?
Yes, she definitely would have had to fill out that same paperwork.
So all the questions on there she would have had to have filled out, including when was her last period, whether or not she was pregnant, whether she was taking any kind of medications, and so on and so forth, correct?
That's correct. And the same to get a massage. So she would have had to have had that paperwork filled out prior to getting a massage.
So would you have seen that paperwork before you gave the massage?
Yes, and what I typically do is just go in, meet the person before I do anything to the person, ask them a few questions, go out of the room. If I think that they had medical things that I needed to look over, or if the doctor would have flagged the chart, I would have taken a few minutes to wash my hands, read the chart, and then go back in the room.
Okay, did you ask her any questions before you began the massage?
I did. I always ask every patient, especially a female patient, 3 questions before I begin the massage. Her chart wasn't flagged, so I didn't really look over the notes in detail for what was going on with her, but I did ask her. I asked her if she was pregnant. I asked her if she was on any blood thinners, and I asked her if she thought there was anything that I should know about her health before I begin the massage.
And when you asked her if she was pregnant, what was her response?
She said no.
She said no. And I'm sorry, I don't think I've asked you this question. When did this massage take place?
I want to say it happened in the end of February, early March of 2008, but it definitely happened between January and the beginning of March of 2008.
So sometime in that time period, okay.
Yes.
Okay, so, and you asked that question, and she said no.
That's right.
Okay.
Yes.
Now, during the massage, what was the state of her, let's say, I mean, how much was she wearing during the massage, I should say?
Well, usually most women keep the underwear on and cover up with a blanket. In this case, she would have covered up with she was covered up with a sheet and like a thicker blanket. The way I remember it was that she just had her underwear on. And I know that because when I came back into the room to give her a massage, she was lying face down, which means your head is in a face cradle looking down, and you're laying on your stomach. And I began the massage on her neck and upper back. And I remember that because I remember that being a complaint of hers, was that her neck was really hurting.
Her neck was really hurting. Now, was she laying face down on the table?
Correct, yes.
She was, okay. Now, you know that if you gave a massage in either January or February, she would have been about, from what I understand, 5 to 6 months pregnant, maybe 7 months pregnant. Did she appear to be pregnant to you when you looked at her?
No, she didn't appear to be pregnant, and I had no reason to think that she was pregnant.
No reason whatsoever?
No, not at all.
Have you ever, or had you at that time, ever given a massage to women who were pregnant?
Yeah, several.
Several. And is there a different kind of procedure that you go through, a different approach that happens when a woman's pregnant?
Yes, it's really, really different. Where you touch them, how you touch them, even the way they lie down, they would never lay on their back, on their stomach, or straight on their back. You would either have special pillows or use a special massage table, or you would prop them up a special way on their side. In some women's cases, they have to sit in a chair and receive a chair massage. It just depends on the woman and their pregnancy. But you wouldn't lay them typically just in a lay down position on their back or on their stomach.
When you massaged her, did you give a massage anywhere around her abdomen area?
I did. That was another complaint. She just said that her stomach was really sore, and I didn't do a firm massage, and I wouldn't have had the sheet or the blanket all the way off her chest where I could see her naked, but I would have pulled the thicker blanket down and left the sheet tucked on around her, and then with light pressure rub her stomach.
Right, but you would have felt her entire stomach, abdomen area, is that correct?
That is correct, yes.
Okay, and I'm going to ask you to kind of make a judgment call here. While you were massaging her abdomen, was there anything about that indicated to you that she might have a child or have a fetus inside of her?
No, nothing at all. I was just concerned because of how tender she was, and I remember just letting the nurse know after that I thought maybe she might have a urinary tract infection, and I had let her know that too.
Oh, really?
Yeah, because she was really tender, but her stomach wasn't rounded or firm, and there was no movement in her stomach at all to indicate there was a baby in there. And I was really, really shocked when she announced that she had had a baby a few months later.
Okay, a few months later, okay. And were you the only one shocked in the office, or was everybody pretty shocked?
The whole entire office was shocked and talked about it for a number of days, and there's a lot of hurt feelings in the office, and people were just really upset.
Why were they upset?
I can't speak for them, but I just think they just felt a sense of betrayal by the patient and just shocked because nobody knew that she was pregnant. And I think she just would have been treated in a very, very different way, especially, I'm the one that gave her a massage that time. And I know she had been seen for a few other procedures in the office, and I just think everybody was concerned. And
were some of those procedures... I'm sorry, go ahead.
It's okay. I just think more than anything, people were just really, really shocked because they had no clue that she was pregnant.
Now, were there some procedures that took place in that spa that would not have been given to a woman who was pregnant?
Yeah, there's several things in the spa that would not have been done to somebody who was pregnant, or if they would have been done, they would have been modified.
Right. Do you know for a fact that she might have had some of those treatments?
I know for a fact she did, but I can't say what they were.
Oh,
I can just think that I gave her a massage because I'm the one that gave her the massage.
And I understand that. Did she continue to come there to that spa after your massage? I mean, did she come for other procedures afterwards? Did she come for other massages afterwards?
I believe she had another checkup shortly after that, about 2 weeks after that. And then I don't think that she had come back. To my knowledge, I don't think she'd come back to the spa.
Okay, so around March or so, and she definitely did not come back again after she announced her pregnancy. Is that correct?
That's correct. Yeah.
Okay, so her next visit would have been before she announced that she was pregnant.
Right. That's right.
And yet, still, when she made the announcement, nobody in your office or nobody in that area, in that spa, had any idea that she was with child.
No, nobody. In fact, 2 people cried. They were that upset that they cried. They were really upset.
Out of a feeling of betrayal, or for fear they might have done something to harm the fetus?
Probably both. Probably more a feeling of just a state of shock, but also afraid that they could have hurt her or the baby.
Okay, that's very interesting information, by the way. Let me ask you a question. Going back to the Todd Palin part of this, how often would you say that you and Todd got together? For sex altogether.
It's hard to put a number on it. It's not like a crazy number, but I probably saw him about every other month over the course of almost a full 3 years. I would say at least a minimum of 12 times.
So 12 times. Okay. Okay, Shailey, I think that's going to pretty much do it for us. And let me ask you another question. There is more information that you have at your disposal about Todd Palin and your relationship with him and other things that happened. Is that not correct?
That is correct, yes.
Okay.
And that is in a legal situation.
Right. But you are hoping to get that story out.
Yes, definitely.
Very good. Okay. Well, thank you very much. I'm sorry, before I start that, and you do have documentation to back up much of what you're saying. Is that also correct?
That is correct, yes.
Okay. Well, thank you very much, Shailey.
I have lots of copies.
Go ahead.
I'm sorry, I just was saying I have lots of copies to back up what I'm saying. So I don't retain the only copies.
Okay. Well, thank you very much for your time, Shailey. I really appreciate that. Okay? Okay.
Thank you for calling. Okay,
Nope.
bye-bye.